practitioner for the past 15 years at Prime Medical Center manager in their Dubai Reef Mall branch. A graduate of De La Salle College of Medicine and the University of the Philippines General Hospital, most of her patients are Filipino OFWs and their families. She was the first Filipino doctor of the Prime Healthcare Group, which led to the hiring of 23 other Filipino doctors across the organization's 14 branches in the United Arab Emirates. Dr. Daffodils was awarded the Most Outstanding Physician of the Year at the Gawad Pinoy 2020 by the Filipino Social Club during the 122nd Philippine Independence Day celebration in Dubai. Last year, she was an awardee in the Filipino Times Watchlist Top Healthcare Professionals Middle East Awards and Asia's Pinnacle Awards 2023 from the Philippines awarded as Asia's renowned international medical doctor. She was featured in the Global Filipino Show, episode number 8 in November 2019, and the Global Filipino Success Stories of the Global Filipino magazine in 2020. Being a firm believer in preventive medicine and patient education, Dr. Daffodils has done various community-based lectures, both in the corporate world in UAE and community halls across Dubai, talking about various topics like hypertension, diabetes, breast cancer, back pain, asthma, office ergonomics, trying to reach and educate laymen about the current updates about health. She has also been a constant resource person in radio talk shows and local newspapers. Ladies and gentlemen, to give us a speech about the importance of preventive health for longer life, streaming live from Canada, let's all welcome Dr. Daffodils Guevarra.
Thank you, Miss Ange, for the wonderful introduction and very kind words. It's an absolute honor to be here today as one of the 22 women who try to make this world a better place to live in. And I hope in the next 15 minutes or so, you can learn something from me. I'm going to talk about an advocacy I am deeply passionate about. It's about giving preventive tips on how to live healthier and live longer. So I hope that in the next few minutes or so, you can learn something from me. Um, to do this, I want to give you tips on the ABCD of health. Each letter represents something, and I will want to elaborate on this in the next few slides. Okay, so let's talk about A, no? A and the ABCD of health. A stands for alarming trends in health. We've found out that there are a lot of alarming trends in health happening today, and one of which is one alarming trend we've found out is that people's diets are getting increasingly unhealthy. We Filipinos, we love to eat, right? And for every Christmas dinners, Christmas lunches, family dinners, family outings, we love to eat. And when we say eat, I meant uncontrollable eating, no portion plates available, and our food, unfortunately, is full of saturated fat, sugar, and full of carbohydrates, which in the long run will actually give us consequences in our health. Okay. One alarming trend in health we found out nowadays is that physical activity among people are decreasing. Because of Netflix and media, we tend to just stay at home and not exercise. And this has been also been seen in our children, no? So they tend to actually just stay at home, do video games, watch TV, stay in with their cell phones. And this is pretty alarming because children nowadays usually don't go out anymore and do physical activity. So that is why, as a consequence, another alarming trend in health that we've discovered is that obesity rates are increasing and skyrocketing worldwide. When I say obesity, no, it's defined as a BMI, body mass index, of 30 and above. All right. And according to the World Health Organization, worldwide obesity has nearly tripled since 1975. To show us a dire picture about this, way back 2016, there were 650 million people worldwide, adults who are obese. Now it has ballooned to 1 billion in just 6 years, 2022. And then now it's 2024. I am so sure the numbers have increased. So let's talk about the Philippines. No? How many Filipino adults are obese, meaning with a BMI greater than 30 and above. If you check this slide, Filipinos aged 20 to 59, no, there are 38.6% who are obese, and that's a dire number. That's you're talking about out of 100 Filipinos aged 20 to 59, 38 people are obese, which is quite sad and unfortunate. And because of this, another alarming trend we found out there's an alarming increase in stroke, diabetes, heart disease, and cancer. And these diseases now, which can be seen only in adults, are now seen in children because of, again, the alarming trends in health. The next question that we want to ask ourselves is there a connection in all of these trends in health? Is there a connection? There is a great big yes. And it's all about two main things. It's about us having unhealthy eating. It's all about us having a very unhealthy lifestyle. Okay. And just having an unhealthy diet now or having very poor food choices, this is known to be a risk factor in the world's three leading causes of death. It's about having an increased risk for heart disease, cancer, and stroke. And because of an unhealthy diet, it's a known risk factor for diabetes. Okay, that's with A, no, talking about alarming trends in health. Now let's move on to B, which stands for blood pressure and heart disease. I'm not so sure, not many people know about this. The new definition of hypertension, according to the American Heart Association, way back 2017, is 130 over 80. That means if you have a blood pressure of 130, 80 and above, in two separate occasions, you are considered hypertensive and therefore you might need to drink some medication to control your hypertension. The next question is why do we need to control hypertension? Simply put, it has many foreseeable complications in the future. So somebody with high blood pressure would have these long-term side effects. You have an increased risk for stroke, vision loss, heart failure, heart attack, sexual dysfunction, and kidney disease and failure. Simply put, no. So if you have high blood pressure, in order to actually decrease your incidence or risk for getting all of these, you have to control your blood pressure by taking some medication. Okay, let's talk about the Philippine scenario. So the next question is, how many Filipinos are hypertensive? As you can see here in this slide, no, it's 1 out of 4. 1 out of 4 Filipinos are hypertensive today. And unfortunately, when you say hypertension, it's actually usually asymptomatic, meaning you don't feel anything. And because of that, Filipinos tend to trivialize hypertension. They'll tell us, I don't want to drink medicine. I don't feel anything. I'm not hypertensive. I don't feel anything. But where in fact, just having a BP of 130 over 80 would actually require you to drink some medication for hypertension. So in 1 out of 4 Filipinos are hypertensive, meaning 1 out of 4 Filipinos will need to take some form of blood pressure medication. Okay, let's move on to C, which stands for cancer. Specifically, I want to talk about breast cancer. Breast cancer is one of the most common cancer affecting women worldwide, and it's the leading cause of cancer death among women, according to the World Health Organization. Without action from both government and the community, things will get worse. More than 1 in 10 of all cancers diagnosed for breast cancer. See, one thing about breast cancer, right? One thing I want to tell you guys about breast cancer, it is 100% curable, okay, if detected early. That's the main term, if detected early. So what I want to say, if breast cancer is detected early, and as in stage 0 to 1, you are 100% sure to survive it, but as if breast cancer is detected later, as in stages 2, 3, and 4, which is the metastatic stage, your chances for survival decreases considerably. So technically, what we want to do is we want to detect breast cancer as early as possible to afford early treatment. So the most important words you want to hear is early detection affords early treatment. Okay, so I want to tell everyone in this room today is that for everybody, every woman aged 40 and above, you'll have to try to do a mammogram mammography. It's a simple study. It's a simple procedure, and it's done yearly just so to actually detect early signs of breast cancer. And for those people who are less than 40 years of age, but who has a strong family history of breast cancer, please do your mammogram yearly as well. So onwards to D, which stands for diabetes, which is for me a very important thing nowadays because as you can see in my slide, everywhere across the world, there are around 20% of people worldwide who have diabetes. That's what we call a pandemic of sorts, and it has a very strong burden of care worldwide in terms of health costs. Let's talk about Philippines, no? Filipinos who are diabetic. As you can see in this slide, we're number one in the Asian region in terms of having diabetes compared to Chinese, Korean, Vietnamese, Japanese, and Indian. The Filipinos have a very high prevalence rate of diabetes. And for me, it's spiraling out of control. And we have to definitely do something about this fact, you know. Now let's go to E, no, eating. And when I say eating, I meant healthy eating. Again, Filipinos, no, we really love eating, and it's our main mode of communication among us to eat and to be together, and it involves eating. But when I say eating and healthy eating, I'm talking about having simple tips. We have to do the reverse triangle technique, meaning we have to eat heavy breakfast, medium lunch, and very light dinner. And if you want to have do healthy eating, you have to switch your diet into doing low carb diet and low fat diet. Because we are Asians, we love the rice. You want to cut out on the rice and cut out on the fried food and bread. Please remember that 80% of weight loss comes from proper food choices and healthy eating. So when I say healthy eating versus unhealthy eating, I'm talking about if we can try to ditch out and go less on the carbs and the sugars and try to like increase our intake of vegetables, fruits, whole grains, healthy protein, and more water every day. Okay. So the practice of medicine nowadays has shifted, meaning that we have become more preventive in our approach more than reactive. It's better to be too preventive, to prevent disease, than to react to the disease. And it's all about having a healthy diet, having a healthy lifestyle, doing regular health screening, and it's all about having this choice in our lives, you know. And let's get personal. Why I believe in this and why this is my advocacy is because of this. Let's talk about 2015, almost 10 years ago. I was diabetic, okay? My weight, I am obese. I was obese. My weight was 94 kgs. I was limping. I always had shortness of breath. My blood sugar was 200. I have a very high uric acid. My clothes size was extra large and extra, extra large. I feel very bad going out of some clothing stores because I can't even fit in any of the clothes there, the largest size. So I did my choice. I decided to have a healthy diet. I had a healthy lifestyle. I did my regular screening. I did the choice, and trust me, fast forward to this year, 2024, I'm down to 66 kgs. That's more than 20 kilograms of weight loss. And trust me, and I'm proud of it, I'm not diabetic anymore. Diabetes can be reversed if done early, okay, with the proper lifestyle choices and healthy diet. My uric acid is within normal levels, and thank God my clothes sizes is in the medium to large categories. I'm still a work in progress, but see, because of doing healthy choices in life, I'm now healthier and happier. And I hope this will be an inspiration to all of you out there because technically, by just doing proper choices, lifestyle, diet choices, eating healthily, living healthily, you can actually also live healthier, happier, longer lives. Thank you so much.